Hello, darlings, and happy Sunday. Welcome to Wake Up Well, and this is your weekly COVID-19 update. Coming up on today's show, we are talking more about students going back to school. What do those statistics look like? How is this affecting our mental health, and what you can do to stay healthy during this pandemic? Hello, darlings, and welcome to today's show. I am your host, Portia Scott. And as you guys know, I am never by myself on this show. I am always joined with my co-host, Dr. Donovan Christie, as well as Martinez, Marty Sellers. But before we bring them on the show, I want to know, what are you grateful for, my friends? What are you grateful for, my friends? You know, when I think about this show, we have been doing this show, I want to say, ever since March or April. I cannot believe that we've been doing it for all of these months, bringing in your weekly COVID-19 updates. And so, number one, I am so grateful for each and every one of you. I'm grateful for each and every one of you for showing up on Sundays, for asking your questions, for interacting. We are so grateful to have you join us today. So as we get started, I'm going to welcome my co-host. You guys know how we do. If you guys have any questions, even throughout the show, make sure you put them in the comments because we are answering your questions as well. And so as we begin the show, I'm going to bring on my co-host. My first co-host is Dr. Donovan Christie. How's it going, Doc?
Hey, good evening. Good evening. Doing well.
Doc, you know what? I know you're the founder. I know you're the CEO of ANWAN and as well as the Picture of Health Foundation. But what are you also called? Are you like the medical director of ANWAN too? Is that what you're referred to? I know that's a weird question, but I literally just thought about it as I was bringing you on.
Yeah, well, my title is president and medical director. So
sorry.
Yes. Right. So
president.
I started it. I started the practice back in 2002. Mm-hmm. And so, it's been 18 years now, and we keep plugging along.
I love it. So president and medical director.
Right.
Got it.
Correct.
Yeah. I like that.
Yeah.
You're the medical director somewhere else too, right, Doc?
Well, I'm the director of medical education for a medical school. The third and fourth year students for Ross University, they rotate through WellStar. Mm-hmm. And, we usually have between 60 and 80 students on rotating through the different disciplines of medicine. And I oversee that part of it.
Excellent. I love it. I wanted to say that because I think we always say Dr. Donovan Christie, but there's so much more to Doc. I love him so much.
Thank you so much.
But he does so much. And so as he's coming on, you can imagine all of the roles that he plays. He's the president and medical director. He's the director of education. So he's coming on with all this wealth of knowledge. So you guys are getting some of the top-notch medical information. And so, Doc, I'm just happy you're here. I'm going to go ahead and bring on my second co-host, who is our mental health professional, Martinez, Marty Sellers.
Hello, Portia. How are you?
Hey, Marty, I'm good. And so, Marty, let's get this straight about you too. Are you you're the co-founder, right, of Marcel Consulting?
Yes, I'm the CEO of I try to be like Doc. Doc's my hero. You're my hero in so many ways. So yes, I am the CEO for Marcel Consulting and Mental Health Services.
I know I didn't have to tell you guys. I know I didn't have to do this, but I just want you guys to know that these are professionals on this show, and they take the time out to come and give us all of their good information. So while I am so grateful for everyone that tunes in, I am grateful for you too. So thank you guys so much for being here. Doc, let us know what you're grateful for today.
Yeah. Well, this has been a great weekend. My wife had a birthday yesterday, and
Wow.
it was just good to celebrate her life and the 31 years of marriage that we have built a life together. So, I'm really grateful for her and my offsprings. They threw her a big mash. I actually hung out with her at the spa, a private spa. And then I came back and all the food was cooked, and it was just wonderful to be able to have that. So I'm very grateful for that.
Okay, with a private
Ex-
spa.
Right,
Yeah,
right, right.
it's a private
Marty,
spa.
what are you grateful for?
Portia, I'm so grateful for, during this time, being able to continue to share my story about getting over COVID and really helping to take a lot of the fear and even the stigma away from it. And just grateful for this platform to share. Grateful for you and Doc, who always encourage me and allow us to, just really encourage the people in all the what I like to call COVID fatigue, frustration, and finality that we're trying to get over all this during this time.
Absolutely. I love it. So I want to say hello. There's a couple of people that are on there saying hello. They're coming into the comments. We have Juanita. Hello, Juanita. Thank you so much for joining. I know that is Doc's sister. She has taught him everything he knows. Rena's on. Hello, mommy. Thank you so much for joining, darling. Tiffany Brody is on. She's here in the Atlanta area. Tiffany, thank you so much for joining. So everyone that is commenting, I can see you. If you haven't put a comment in, let us know that you're here and where are you watching from. So you guys, I want to jump in because we have a lot of information. Juanita said, right, I know, Juanita, I know you saw him everything. I remembered. We have a lot of information to cover. King Joseph is on. Hey, Marty. That's what he's saying to you. Pam is
Hey,
on. Hello, darling. Thank you so much for joining. Thank
it's
you,
good to
thank you,
see
thank you.
Pam back.
I know. Pam, we haven't seen you in a while. So let's jump right in. We have a lot of area to cover, and I want to make sure we get your questions as well. So, Doc, we're going to head over to you to open us up with just the numbers. What's going on with the
Okay.
cases?
Well, the cases, and I want to talk a little bit about cases too, just so
Hmm.
Yes.
that we don't get alarmed, because the CDC cases are the based on the amount of cases that have been detected through tests, right? So that number is just approaching. Well, as of yesterday, it was 4,974,959. But I heard earlier that they went over, which wouldn't surprise me. They went over the 5 million mark. But other sources are saying that the cases that are not checked, they're estimating it to be about 90 million people with it. So we're not tested. Everyone has not been tested. So we really don't know. But based on the CDC report, on the tests that we have, it's 4 million cases and 5 million cases and over 161, 284 deaths. That is a lot of people since February.
That is a lot of people. I mean, it really, really is a lot of people. And Doc, I think it's just sometimes it's a lot to take in, and I want to say this is that last week we didn't have the show. And I think Marty said it best is that we try to bring you the information that you need, especially as we're all dealing with like COVID fatigue. And I felt like
Hmm.
that's where I was, Doc. I think I was just, and Marty, in a place in my mind where I was just like, it's so much.
Yes.
Even though I had made the decisions that my kids won't go back to school, they'll digitally learn. I was comfortable with our decisions, but I was just like, I wish this was over, like I just wish
Hmm.
this was over. And so, Marty, as we're looking at these numbers of 5 million, then Doc comes and says that's just people who are tested. So it could
Right.
be 90 million. And I wonder sometime, I know there's tons of people who think I probably had it in February. I had a neighbor that says she thinks she had it in
Mm-hmm.
February, late February, early March, but she didn't get tested. They just thought it was what? The flu or,
Mm-hmm.
the common cold. Marty, just what are some ways that we can deal with, the COVID fatigue? For me, I was like, I just can't do the show. It's just healthy for me. But what are some ways that we can, just kind of deal with it in a very healthy way?
Yes, I think it goes back to what we said a lot earlier in the program back in April, May. Sometimes you have to just get unplugged from everything.
Hmm.
Be mindful of how much social media are you looking at. Be mindful of how much television and news, because the news will overwhelm you. And unfortunately, we are not dealing with this in a healthy way at all because we're making this political instead of making this about lives. And that can also make you become very anxious. Sometimes you have to just de-stress, come unplugged, and do those things that's going to make you reground you and keep you happy. Whether it's I put on my happy shirt today because I'm not able to go on vacation like I want to, so I had to put on a vacation like shirt. Whatever you need to do in order to kind of lower that anxiety, remove that frustration, get grounded, go for a walk. I'm trying to walk 4 and 5 miles now. Ride your bike. Do those things that's going to keep you engaged with those things that you like to do so that you lower your anxiety so that you can deal with it. And it's okay to say, I'm not okay right now and I need to stop doing those things from work. Maybe you don't cook. I don't know. Whatever you need to do, those things so that you can remain healthy and intact.
Absolutely. I love it. Doc, I want to speak to you too. And I think it goes back. What are some of the things, in your practice, or if you were talking to another nurse or another doctor who is in the
Mm-hmm.
hospital system who's seeing this? We're seeing, we heard a case, I think, months back where unfortunately, ER doctor took her own life. And we're seeing the fatigue within the
Hmm.
hospital. And at
Yes.
first it was, we're all heroes. And I think we kind of came back a little bit. We're just so used to them being on the front line. And so, Doc, what is something that
Hmm.
you would say to, that those staff members, that
Yeah.
population?
Well, I'm going to agree wholeheartedly with what Marty has just said.
Mm-hmm.
In our practice, luckily, and Marty knows this, in both locations, we have behavioral health.
Mm-hmm.
So we can escort them from the examination room into the counseling room. So once we pick up a psychological issue, whether it be bereavement or depression,
Right.
anxiety, or they're not coping with things, we can easily get them scheduled, or the behavioral therapist will actually come and talk to them if they're to make sure that there's nothing acute going on. But I do want to say that everybody is different and they deal with stressors, mental stressors, differently. Some people are very hardcore and their resistance is tough, and other
Yes.
people are very friable. The slightest things really, tips them over. So we have to be able to assess that in as practitioners, and then to do the appropriate referral and treatment. But for me personally, I just have a lot of faith in God, and I know
Mm-hmm.
that with my faith, all my worries go away because I know that I'm a child of God, and I know that
Yes.
I'm doing His work, and I feel very confident that He's going to protect me.
Absolutely. I love it, Doc. So let's get up. So we do have a question. I'm just going to ask this so I don't miss it. But, Doc, how many times should someone be tested? I'm sure that just depends on the work that they do. But
Mm-hmm.
how many times should someone be tested?
Yeah, and you answered it. It really depends on your exposure. If you're home,
Right.
if you're home all day, which some people are because they're very risk averse, they don't really need to be tested unless they
Right.
develop symptoms, right?
Mm-hmm.
But if they're out there and they have known exposure, or they believe that they've been exposed, they
Mm-hmm.
can get tested at that time. But the testing brings about its whole set of problems when you do test positive, and what are the different types of tests, and what that means. If you get it, should you get retested? We can talk about that as well.
But what I've
Absolutely.
been noticing also, Doc and Portia, that even in the testing process, people
Hmm.
who've had multiple tests, there's a lot of anxiety because it's taking 5 to 7 days out here in Southern California. Do I go to work? Don't I go to work? Do I isolate? All those things. I've had people just, and I'm like, okay, let's talk through this again. Someone's like, I
Mhm.
got it. Like, well, okay, let's talk through this.
Yeah.
Hmm.
Who have you been in contact with?
Right.
What are the symptoms you're
Right.
feeling with that? And just kind of, for lack of a better phrase, talking people off the ledge. But I love one of the comments that said, "Know your body and know yourself as well."
Hmm.
Like Doc
Exactly.
said, because we all are different, and some
Right.
Mhm.
people handle anxiety and stress way differently than others. Know yourself, know
Mhm.
your
Know your
body,
body.
and know what you can and cannot handle, and who is your support system in
Mhm.
all of this.
Absolutely.
Well, and then sometimes people are asymptomatic and they do
Mm-hmm.
come in and get a test. They get the antibody test, which is
Mm-hmm.
it tests for the immunoglobulin in your body, which your immune system puts out after exposure, right? Um, but there are people who don't get any type of respiratory symptoms. They get GI symptoms, gastrointestinal symptoms. One of our docs, a moonlighter, a part-timer, a per diem provider, you would call him, he was out for a month because he had to get bowel surgery. He ended
Wow.
up having partial colectomy, partial piece of his colon removed because he developed diverticulitis, which he states that he got that from COVID. And I'm thinking,
Wow.
but he had a history of diverticulitis in the past, but
Okay.
he believes that the inflammatory cascade, the cytokine storm, triggered his diverticulosis, litis, and then that's what caused his abdominal issues and surgery.
Wow.
Yeah,
So we're talking about testing, Doc. Let's talk about that a little bit, especially as these kids are moving into school, right? So
Right.
what are the testing nationally? What's that testing wait time look like now on
yeah.
average?
Well, remember, we just came out of a really bad month. July was really bad.
Mm-hmm.
June was bad. Remember, I showed you the data back on June 1st, where we were down to about 15,000 cases a day. And then pretty much the entire month of June and July, we were over 60,000 new cases being diagnosed per day. So there's a lot of testing being going on. Now, the during those peak times, it was taking as much as 10 days to get a nasal swab test.
Mm-hmm.
And the rapid tests, you have two rapid tests. Okay, one is testing for the virus particle itself, a piece of the virus. We're just going to test to see, do you have a piece of that virus? And it's called an antigen, right? So it's a piece of it. It's a protein that's attached to the virus. You can get that test in an hour, but that test is so limited in terms of the availability of it. Only hospitals can get it. Say you're going in for emergency surgery or you're going to be admitted, everybody gets tested with that that test, and it's made by Abbott. So you can find that out pretty much in an hour, before you get admitted. We can't get that as a primary care doctor. I can't get that test. So when I first tried to get it a couple months back, it was always an access issue. They just don't have enough of that. So the test that we do is the test for pretty much for asymptomatic people, or if people think they have it or have had symptoms, but now or a week into it, then their body would have mounted that antibody response, and then we check that that antibody, and that's a rapid test as well. You find that out within 30 minutes, and so we've done, Portia, over 1,000 of these antibody tests,
Wow.
and there many of the people, I would say pretty much 75 to 90% of the people who've tested were asymptomatic, because that's when how the test is valuable when you're asymptomatic.
Mm.
If you're symptomatic, you need to get either that rapid antigen test or you get the PCR nasal swab test that takes 7 to 10 days.
Okay. Yeah. I think it's kind of funny that like if you have the symptoms, but you don't have that antigen test, and then you have the swab test, and then you're kind of like where Marty was. And
Mhm.
Mm-hmm.
by the time they found out, they had already gone through days
Right,
of, the
right.
symptoms and things like that. So,
Right.
as the kids are moving in, Doc, going to school, I know here in even in Gwinnett County, the kids are starting off next week. Everybody's going to be digital, but they're slowly moving kids in over the next 3 weeks. So by the first week of September, all of the kids will be in school. I don't know, in Gwinnett County, they're not mandating that those kids are tested prior to them coming. But let's talk a little bit about the cases with kids, because at
Mhm.
first it was like, kids don't get it,
Yeah.
and so I just want to talk a little bit about the cases in kids.
Yeah, well, kids do get it. They're just when I go through the cases by age group and the deaths by age group, I think that's where people will be bravado about sending their kids back to school, because when you compare the death rate in kids compared to that of, say, someone over the age of 65, it is a tremendous difference, right?
Mhm.
So the case fatality rate is just much less. But overall, if you had 100,000 kids, the way the scientific community would rate the overall rate of infection per 100,000 kids, that's 447 cases per 100,000 people. So you think that's not that much if you have 100,000 and only 447 cases.
Right.
So, percentage wise, it's from all the tests, it's about 8% of kids that have tested positive compared to the adult population that has been tested.
Yeah. I think one of the things that, and you are right. When you see that, you're saying, "Oh, I'll send my kids to school." I think the
Mhm.
thing is, and even when you kind of broke it down into deaths by kids, I mean, it's substantially smaller than, as you get up in the age groups. But I
Mhm.
think the problem is they bring it home,
Right.
right? And
That's
so
that's the
And
problem.
and so some of it was kids can't get it, but then it was that they can't pass it along. So kids are definitely able to transmit this virus, right? Even below
Mhm.
the age of 10, Doc, or
Oh yeah, most definitely. They can. I think any kid can transmit it. And over the last couple of weeks, so that that more and more kids are getting it,
Yes.
97,000 kids have tested positive from the middle of July until August 1st. 97,000. So that it's going up in
Wow.
terms of the amount of kids that are being tested
Mhm.
and being tested positive. So the more testing we do, if you believe in what I said initially, that there's really over 90 million people with this disease, the
Absolutely.
more testing we do is the more positives we're going to get.
And I
So
think
there you go for Donald Trump, and stop the testing.
right. I think one of the other things that's resounding is that 7-year-old kid in Georgia who died, I believe, this past week from COVID, and he's really our first no, not that young, but still that's recent. That
Right.
is really sounding the alarm with that, and we definitely are seeing even in our child care and across the nation as schools are opening, and they're going back to face attendance at schools, that the number of cases are increasing. So we
All going to
can't,
go up.
yeah,
We
we can't
can't
ignore
stop that.
that.
Yeah, it's going to go up. And so
Hmm.
when you look at 5 million, let's look at that number.
Mhm.
Right.
338,000 out of
Hmm.
the 5 million were kids under the age of 18.
Wow.
Now, in July alone, I want to go through the death rate, because I think that's where, people are saying, well, kids are dying from other things. They're dying from
Hmm.
cancer, they're dying from heart disease, they're dying from other infectious diseases. And so, what is the big deal? But in this last month, we've had 25 kids, including the 7-year-old Marty in Georgia. Uh,
Right.
25 kids have died from COVID in July. Let's break this down by age group, okay?
Hmm.
So, under one, from February 1st, which is when we really started focusing on COVID-19, to August 1st, we've had, and the numbers are going to seem small, but 15 deaths in kids under the age of 1. 15 kids, 12 months or under, have died from COVID. From the ages of 1 through 4, we've only had 10 deaths. Um, Actually, yeah, of 10 deaths. From 5 to 14, we've had 20 deaths. And then from 14 to 24, now you're getting into the older kids,
Mm-hmm.
the teenagers and all, 225 deaths. But look how it jumps up as you move up.
Mhm.
From 25 to 34, 1,000 deaths.
Right.
From 35 to 44, almost 3,000 deaths. From 45 to 54, 7,000 deaths.
Mm.
From 55 to 64, that's my age group, we have 17,583 deaths. And from 65 to 74, we have 29,000 deaths.
Wow.
From 75 to 84, 37,000 deaths.
Wow.
You can
Wow.
see the escalation, how as
Yes.
you get older, how many people
Your
are
risk.
dying when they
Mm-hmm.
get the disease,
Right.
you're dying from it. It's the
Yeah.
older you are. And over 84 is 45,000.
Mhm.
45,000 people have died.
Wow. That's so many
So
people.
old people should not get this disease. So as Portia said, if these kids come home, school age kids come home and they have it and they're
Exactly.
dealing with it just like they would a normal upper respiratory infection, but they may give that to
Right.
someone in their 30s, their 40s, their 50s, their 60s,
Mhm.
70s,
Yeah.
whatever. And those are the ones who may die from it.
Absolutely.
And that's very not to cut you. I'm sorry, Portia. That's very
Yeah.
concerning, especially with a lot of in our black and brown communities
Oh,
where
yeah.
grandmothers are
Yes.
raising their children, their grandchildren, and they're
Yeah.
being parents to their grandchildren. So that's
Right.
very alarming. As Big Mama is now taking care of them or watching them after school, while the single mother or single father might be at work. In
Mhm.
all that. So we're now having lots of issues that we have to deal with and quarantining issues with that.
Yeah.
And should special circumstances and allowances be allowed for that population group who is most at risk because we're putting two precious groups at risk, our children and our
And our
elderly.
elderly.
Mm-hmm.
Absolutely.
And you know what, Marty, you talk about race, but across the board for most chronic diseases, if you look at people of color,
Mm-hmm.
Hispanics and blacks, we
Right.
have the highest rates
Yes.
of obesity.
Yep.
We have the highest rates of heart disease, which is the nation's number one killer. Highest
Yes.
rates of cancer, asthma.
Yes.
We make up. We're talking about rates. We make up pretty much 11 to 12% of the population.
Right.
Hispanics probably 15% of the
Yes.
population, and yet still we have much higher rates of this particular chronic disease. Plus, with COVID-19, most of the kids that have died from this
Yes.
are minority kids.
Mm-hmm. Wow.
Minority kids, and the biggest risk factor is, guess what? Obesity.
Obesity. Mm-hmm.
Yeah. I know Doc, we definitely have to have a show just where we talk about that, right? And I think it's important that we kind of come up with some solutions in those neighborhoods. So I do want to hit some questions. We have tons of them. So Nicole said, I had a very close friend who recently had a fever for 6 days, itchy throat, body aches. She had the rapid test done the first day of her symptoms and it was negative for COVID. She was very confused and still thinks it may have been a false negative. Doc, I know early on we kind of talked about some false negatives. Is that something that could have been for that rapid test?
No, I mean, I think if she had the antibody test, she basically didn't mount that response yet. It takes 7 to 10 days to mount a response after you've been infected for most people. So she came in when she had the symptoms, but she had not started her antibody response. Now, if she had an antigen test, then and it was negative, then it would have been a false negative. But if she had the antibody test, if she goes back now and gets tested for the antibody 2 weeks out, she will most likely be positive.
Mm.
Got it. Okay. So we also had one, Joseph, thank you so much for the artwork. I appreciate it for that comment. Marlene had a question. She said, I purchased a non-touch forehead thermometer because her nurse, dentist, etc., takes her temperature when going to places of business. And as a result, I too want to feel safe. Is it wrong for me to feel that way? We need to take their temperature also with my own $50 no-touch thermometer. Um,
Yeah,
Marlene, go
yeah,
ahead.
yeah. I know. Those no touch thermometers. They're infrared thermometers,
Mm-hmm.
and they've gotten better. A lot of times though, when you check it, people's temperature will be 95, 96, 97. So you have to have a really good fever for it to really show over 99.5, which is what a fever is, 99.5, a full degree above 98.6 for you to say they have a fever. But no, I mean, I think if you want to get one of those, you can. I just don't, I pretty much we check. We're a doctor's office, so when people come in, we do use the infrared on
Mhm.
them at the door before they actually are brought back, and that's just an added precaution. But you have
Mm-hmm.
to wear your mask. In the office, we wear face shields if patients exhibit symptoms, and gloves and gowns. We have all of that ready to go, but we definitely have our masks on at all times. So, the temperature, I think too many people put too much investment into the temperature. The bottom line is that if you're sick,
Mm-hmm.
you should stay home, whether you test, whether you're waiting on a test or not. Just stay home because you most likely will infect someone if you're not wearing a mask, and you don't want to continue to spread this disease if you're sick. So if you're asymptomatic, you should go about your business. Just wear your mask and carry on because there's a lot of people out there like that.
Absolutely. Go ahead, Marty.
Yeah, no, I think Doc, you're definitely speaking to a lot of people, and I'm finding that a lot of places use that. Now we use it in our own office too, and I think it brings about comfort for people in a lot of ways. But we make sure everyone wears their mask. We are not seeing any patients. Physically, everything is still via Zoom sessions and everything. But even for our staff, and we tell them if you're not feeling well or anything, go home and let us know the next day. If you need to take some time off, take some time off. That's what it's about. And again, when we're saying you have to know your body, people, we got to be honest with each other and be honest with yourself. I know
Correct.
we're in fatigue, but it's about your future and how we're all going to get over this together. We have to be honest with ourselves and really get a better grasp of our own mental health and our own physical health. If nothing else, I've been a lot more vigilant about my mental health, a lot more, even more vigilant about my physical health, and vigilant about what I'm eating and the supplements that Doc has definitely recommended. I appreciate that. Here's the sad thing, I probably feel better now post having COVID than I did even pre COVID because I'm being healthy.
Yes, right.
Absolutely.
I feel
You're
Absolutely.
amazing.
walking
Yes,
4 or 5 miles.
Yes.
Yes, I'm impressed.
Yes, I
that's
am.
Good
right.
to see that's rubbing off on you, Marty.
Right, right. So I do want to pull up a question. Deja had a question. Marty, I think we're going to really speak to this and to her
Uh-huh.
question, but also her subsequent comment. She's going to keep her first grader home as she knows it's best, but she's not really happy about it. Right? It's hard. She's feeling anxious about balancing everything: work, parenting, homeschooling. So, Marty, I really want you to speak to this because this was one of the questions as well, is that
Yes.
what are ways that parents can stay mentally, healthy, especially those in Deja's predicament where they are keeping their kids home because they feel it's the best thing to do, but they're also nervous and anxious about being able to juggle everything else.
Most definitely. I love acronyms. So my acronym today is remain calm.
Hmm.
Remain calm. And my C, calm, in the C in the calm says continue to communicate. Communicate with everyone in your family. Communicate with your children. Allow them to also share
Hmm.
their frustrations, their nervousness with that. My 4 year old, she has a little bit of anxiety because she didn't see us for 3 weeks, over 3.5 weeks. And so now she's like, I'm coming home, right? I'm coming home because you're going to be lonely without me. We can keep that communication open. She's allowed to draw pictures. She's allowed to share. She's been a little bit more clingy, which is natural because there was a little bit of separation anxiety that went through that. So continue to communicate. The A stands for allow for allowances. And when I'm saying allowances, if you're feeling like I can't do this homework today or your kid can't do this homework today, it's okay. If you need to take those breaks in there, they do 45 minutes worth of instruction once they get to middle school and high school, and then they have a break. Put in breaks. Allow for those allowances that you can keep your sanity and remain calm and work through the day. The L. The L stands for leave behind what I like to call loneliness, which I partner that with the allowances. We're going to feel lonely. It's okay. But do those things that will allow you to, one, address the loneliness, and two, replace the loneliness with positive affirmations and positive coping skills to help you along the way. And finally, the M. Maintain your motivations and your momentum. And that's if you got to do, again, Doc is always on this: exercising, eating healthy, doing those things, getting proper sleep and rest, getting unplugged from social media and television, maintaining whatever motivation and momentum that you have to do. So in that, I say remain calm and please take those things into action to help you throughout your day.
I love that, Marty. I think that's going to be
Awesome.
very, very good for parents, but also
Mm-hmm.
parents that happen to be teachers. One of the,
Right.
the very first thing you said about communication was, I remember at the beginning, I had set up a whole station downstairs for my kids. I was
Right.
ready to go. I was like, we're all organized. We got our schedules. We are doing this. And I remember the kids saying, well, I want to do the work in my room. And immediately me, I'm a tiger mom, but I'm working on it. I'm working on it. And I was
Okay.
like, no, the only reason why you want to do that is because you want to play your game. You want to do, right? So we go through this
Uh-huh.
thing and then we have this conversation. And I say,
Right.
how can I support you? Because I think
Beautiful.
so much we were thinking about how do we just do it? And I said, how can I support you? And what I realized, Marty, was going into their rooms was a safe space. Their life had
Yes.
already been uprooted. And even though it was in their house, being downstairs was another change. So if they were
Yes.
in their room, so I realized that downstairs,
Beautiful.
even though I was there, they were not paying attention. They were running around like banshees. They were taking more breaks. They were eating all my food.
Oh
And then
yeah,
when
the
they,
grocery bill goes
right,
up.
exactly. And then when we went to their rooms, they were much more focused. I mean, they still had their things because they're kids, but they were much more focused. My daughter's grade in math went
Wow.
up. And
Yes.
so, I mean, I say that because you said communicate. And I think one of those
Hmm.
things is asking them, how can we support you?
That's
And
beautiful.
when you have that dialogue and that understanding, she has a first grader. I had a first grader. Maddox is going into second, but he was in first at the
Uh-huh.
beginning when all this started. So I think children are much more resilient than we give them
Yes.
credit for, and they're extremely, extremely smart to the level where they are, and so they can sometimes they will articulate that. They may not know this is what I want. But when I saw that,
Right.
I was like, oh, their rooms, it's a safe place for them. And it's been so much. And I had a
Yes.
12-year-old that could articulate that it's just safe there. I feel like this is the one place that hasn't changed. Right.
You said
So,
something that's key that I use a lot in my couples therapy too, to say, how can I support you to be successful today? And
mhm,
Mhm.
starting off each day like that with your children, and even at the end of the day, hey, were you successful? And if not, what can I do differently? Or
right.
if you were, taking those moments and celebrating that success.
Right.
Small celebrations mean so much. Don't wait for the big events to celebrate. Celebrate daily celebrations. We made it today. You did a great job in your room. You were
Yep.
focused. How can
Yep.
I, and that is, I'm proud of you about that. And more parents, listen, just ask her, how can I support you? How can I
I love
support you
that.
with your emotions? How can I support you with your schoolwork? How can I even support you with your socialization in that? And then even ask them, hey, were you successful in that? Great
Hmm.
job.
I
Yes.
love that. So we have a couple of questions. What is the likelihood, Doc? This one is for you that you can get the this is from Trish, obviously.
Yes.
Trish had the virus. And she wants to know, can she get it again? And how will we be able to
Mm.
differentiate between COVID and the regular flu this fall? Great. That was actually a question, Trish. Thanks. So thanks for asking that. Doc,
Yeah,
I'll let you take that one away.
sure, sure, sure. The likelihood of getting COVID-19 twice is slim, very slim. And it has to do with two things. One, you may have had the infection, but you had a very mild infection, and you did not mount those antibodies I talk about.
Mm-hmm.
Or you didn't mount a good memory antibody. So when you were exposed again, you didn't have enough to get rid of the infection itself. Because that's what antibodies, that's what vaccines, that's the whole principle behind vaccines is to allow you or the disease itself, allow your body to create antibodies that at the next time you come in contact with it, like for instance measles, if you've had it and you have antibodies that are long lived, as soon as that virus enters your body, it's recognized by the immune system and then eliminated. So the chances of you getting it again, Trish, is very, very, very small. What I would get, what I would do is to get an antibody test 2 weeks after you were originally diagnosed,
Mm.
so you know where you stand. It doesn't mean you walk around the world without a mask anymore.
Well, we
Right.
have to wear them out here in
I've had it already.
California.
I'm good. I'm good. No, you still wear your mask. You still
Yes.
do the things that you would normally do based on the guidelines that are out there. That's going to prevent transmission. So that's pretty much what that is.
Doc, another question, because we know that a lot of our in our community, there's a lot of pre-existing conditions. So
Right.
those who may have pre-existing conditions caught COVID and now are still feeling some of these aftermath.
Oh,
What are some of your suggestions if you've had asthma, maybe you
mhm.
have diabetes or high blood pressure, any of those things, and you're coming and rebounding from that? Do you
Right.
have any suggestions on how we
Yeah.
can even be more vigilant about that?
Mhm. Very good. Very good question because we've had people who've had COVID and they've had it for 2, 3 days and they're symptoms free. Oh, I'm good. I'm good.
Mm-hmm.
They've taken their vitamin C, they've
Mm-hmm.
taken their zinc, they make sure that their D, they have their blood levels of D is good, and they
Right.
get better quick. And then you have the people. I have several people now who've had COVID symptoms for
Wow.
over a month, lingering cough,
Wow.
that's lingering,
Yes.
or um, just the fatigue, the
Mm-hmm.
post-COVID viral fatigue syndrome that we're seeing a lot of. People just not getting back to themselves. And the only thing, if you say pre-existing condition,
Mm-hmm.
that's an insurance term, but it's really what we call comorbidities, right?
Comorbidity. Yes.
Additional disease processes that makes you more at risk should you get the disease. The
Yes.
number one risk for death of COVID is obesity. I said that for
Mm.
kids, I say
Yes.
for the adults. Most of the people who are in ICUs from COVID are obese. Not that everyone is, but that is the biggest risk factor. Diabetes and any autoimmune disease puts you at significant risk as well. Cardiovascular disease, congestive heart failure, things like that, coronary disease with a
Mm-hmm.
weakened heart, those will definitely put you at a higher risk as well. So what you would, if you have that, and I have several patients, I have one guy who had congestive heart failure. He's
Mm-hmm.
going into his third week now. He spent a week in the hospital, came out, but he was discharged on oxygen. He still had oxygen, still had an
Mm.
oxygen requirement. And so what we're doing with him, we're just tanking him up with nutrition, and we're
Mm-hmm.
giving him, and we're tapering his oxygen down over a slope over a longer period of time until he can live without it again, because he didn't have it before he had COVID.
Right.
So we know he can get off of it eventually. So it's really just your immune system. Stay away from
Right.
sugar. Sugar suppresses the immune system. Sugar suppresses the immune system. Don't
My
start eating
cookies.
your donuts and your cookies and all that sweet. Oh
Pray
yeah,
for me. I need
your
my coffee and donut.
sugar is a big immune suppressant.
Oh
You
wow.
might as well take steroids in that case.
Wow.
So
Oh,
stay away from sugar.
okay. Fruit,
So,
fruit, fruit.
Doc,
Uh,
one of the questions I'm going to go back to Trish Daryl is follow up between our two houses. We have a 4-year old and a 21-year old who have tested negative. Is there anything else we should do to keep them from getting the virus? So, Trisha had it, but she has a 21-year-old and then a 4-year-old, and so they've tested negative. But I think her concern is there anything else they need to do to keep them from
sure.
the virus?
Yeah. If she lives in the same household with them, if they're in the same house with her, she needs to make sure that they do not use her bathroom. She needs to have her own individual bathroom. And when she's around them, she should by all means wear her mask. She should not be in the same room with them for a longer period of time, more than just to have meals probably, and that's it. Because they can get it. We know from the death statistics that I just reported that they will do relatively well when they do get it. But if you don't want them to get it, you're just going to have to practice good social distance even within the home, because they're there with you.
Mm.
Mhm. Wow. I know. Marty's like, oh, okay. Right, right. It's so funny because all these things, months ago, this didn't pertain to any of us, but currently,
Right.
everything we're saying pertains to you guys. Yeah,
But
Magaline.
after 2 weeks, you're theoretically, and they don't know this, right? But
Right.
you should not be able to transmit the virus. You're not infectious anymore.
Right.
That's why they say 2 weeks without symptoms,
Right.
you're fine. You're not going to give it to your loved ones.
That's right.
I so
Right?
understand that more and more now.
Yeah.
Yeah, yeah.
I do.
Yeah.
How long after the positive test results do we have to maintain the social distancing? I think you probably just spoke to that. I think in the
No,
house
not
is what
really.
she's
No,
saying.
because you could have the positive result. That's a key point. You can have a positive result and you're symptomatic, right? So you have to wait till you have no symptoms. That's the issue. Like these people who are dragged out, the people with the comorbidities that are still having
Mm-hmm.
some type of symptom, they're theoretically, by definition, they're still able to transmit that virus. So
Mm.
it's 10 to 14 days without symptoms, no symptoms. That's
Wow.
the key. It's based on symptoms.
Wow. Okay. He is like, do you accept virtual clients across state lines?
Call Doc at the
Trish,
end.
Trish, you're gonna have to talk to Doc offline. But I love it. I love it. Doc, we're trying to get you patience. Listen.
Yeah, yeah, right.
But
But we do lots, just like Marty does. We do a lot of online,
Mm-hmm.
telemedicine visits. So that's definitely something we do.
okay, excellent.
Mhm.
So Marty, I do want to ask this question. As the kids are going back to school,
Mm-hmm.
Um, I just want to know what are some signs that teachers and parents should look for in children that may show that they're struggling mentally? Because sometimes kids may not act out the way that we do, but what are some of the signs that, maybe your child is struggling? I
Yes.
think it's important that teachers see this, especially as
Yes.
children are going in, but even their children that are distancing learning so that, they're
Yes.
seeing them online or even parents. So where we think it's a behavioral issue and it's not really a behavioral issue, but it is struggling mentally. So, what are some of those signs?
You are absolutely right in that, and that's a great sign. We're grateful that we are doing online learning out here. at the earliest, they're talking about January returning to based upon numbers. So now we're on this anxiety about now what do I do? But you're absolutely right. Behavioral, especially for our younger elementary, upper elementary, you're going to see if you see behavioral changes in them. I spoke to that some of the younger ones. If you see them reverting back to behaviors that are kind of below their age and everything, that's a perfect sign that something could be going on with that. With Tony, because she's preschool and all that, we saw some clingy behavior, some acting like a baby. So we needed to talk through some of those things. With our elementary kids, again, the hitting and all of that, because they don't know how to deal with anxiety and anger. So we might see an increase of hitting in that as well. For boys, let me say this specifically for young boys. Anger is a sign most of the time of depression in those regards. And we I share this all the time. I think a lot of our boys have been misdiagnosed as oppositional defiant or conduct disorder when in actuality they're depressed because boys are taught suppress that, man up, don't be a punk and all that. Boys don't show emotions with that, so they explode a lot of times in those regards. So those are a lot of we seeing drastic behavioral changes, not hanging out, not talking to the same group of friends that they used to, isolating a lot, sleeping more, or even eating more, sleeping less, in those type of things. I know it's that balance. Again, we want to look at know your kids' behavioral patterns, and if there's some drastic changes that's lasting more than 2 weeks, that can raise your eyebrow of concern, and then maybe seeing how you can talk it through with them.
Yeah, I really do love that. I know even with kids that go back to like bedwetting and things like
Yes,
that,
yes,
just like you said,
Converting.
going back to a former stage that they
yes,
should have passed by now. And I think that's so
yes,
important, as parents, because it's easy for us to quickly say, where's that behavior come from?
right,
I will say me, instead of kind of looking and saying, you got to look at the environment that we're in, right? This isn't pre-COVID environment where the kids are back in school, where they're socially,
right.
with their friends and everything like that. So Doc, one of the things Nicole wants to know, she said, I'm gonna just be bold and put it out here. What is considered obese for, let's say, a 5 foot 48-year-old woman? She's asking for a
Asking
friend.
for a friend.
Well, the definition of obese is having a BMI, a body mass index, greater than 30. Um, and I would tell you that there's a lot of social, ethnic um,
Mm-hmm.
things to that because those numbers really don't take into consideration your muscle mass or your bone mass. So, a BMI is what we use because it's easy. It's just looking at your weight and by your height, and through the formula, come up with a number that should be under 30. So they're saying that 20 to 25 is normal weight, between 25 and 30 is overweight, and over 30 is obese. And if it's over 40, which we have quite a few people in that category, then you're considered morbidly obese. So a 5 foot woman should probably weigh no more than 130 to 140 pounds. That would be at the high end. And then they would probably be considered a little overweight if they were over 130. But 5 foot is short. We have lots of stocky people that are short, and so their BMI far exceeds that. So it really has to do with how much muscle you have on your body and how much fat. Fat is the deadly tissue that stores inflammation and puts you at risk for diabetes and heart disease, including cancer. So, yeah.
Absolutely. So Doc, we're gonna do two more questions questions, I'm gonna go look up my BMI. But Doc, I've been your girl, been out running about 3 days a week. Look at me. I'm
Mhm.
All right.
Doc.
Go, Portia.
I tried to do the Strava app, and
Yeah.
it doesn't sync up with my Apple Watch, and so it doesn't count my calories well. So that's what that's
But,
why I, I know
oh,
this is
okay.
a
Yeah.
total
Because
side note,
yeah,
but
the
but yeah,
calories. Okay.
I know calories. I know. But it takes in my heart rate and all of that stuff.
Right.
But but one of the questions I do want to get to and is Deja. So Deja said, "What supplements
Hmm.
do you recommend?"
That's good.
Just to go ahead and take. I know we've gone over it before, Doc. If you can just kind of give us a couple supplements that
Sure.
you recommend just to keep us healthy.
But just for routine, say without COVID, for routine supplementation, everybody should be taking omega three, omega three fish oil. You can get omega three from plant based foods as well. Flaxseed will have it, but fish, the source of fish, is the best. Everyone should be on a probiotic for gut health because 90% of your immune system, guess what, lies in your gut. That is the entrance of where bacteria, where viruses, fungi, parasites come through your gut. So if you're stressed out and you develop leaky gut, then your good bacteria are going to die out and the bad bacteria is going to overgrow things like serratia and clostridia and helicobacter. Those things overgrow yeast in your system, weakening your immune system. So you want to put in good probiotics every day, just to maintain it because like I said, stress will kill those out. So and you need a good multivitamin. Those are the basic minimum three. A good basic multivitamin with minerals and herbs in it. Um, Probiotic and omega-3 fish oil. That's just what you should take regularly. Now, to boost your immune system, because we don't get out and get as much sunlight and we're not eating as much fish, 90% of Americans are deficient in vitamin D. And guess what? Vitamin D is the most important vitamin for your immune system. We all know that vitamin D is good for your bones. We've heard that. And oh, you have to drink milk. Milk does not have vitamin D in it. It is fortified with vitamin D. So you don't have to drink milk. You take your vitamin D, you know. So that's what it is. The milk industry basically fooled us into believe we have to drink milk to get vitamin D when vitamin D comes from fish. It's a source from fish, from oily fish. That's the highest content of vitamin D. You can get it from plants as well, but the highest amount comes from fish. So vitamin D is important. Pasteur in the 60s told us how beneficial vitamin C is. It's very good. It's a great antioxidant. It helps to normalize your immune system and to reduce free radical loads. So you should be taking vitamin C. Zinc. Zinc has been shown to alkalinize the blood, which reduces the virus's attack on our cells. The virus to replicate needs an acidic environment. So when you're taking zinc, you're creating an alkaline environment in your body, kind of preventing it from sticking to your cells. So those are the three things that you should be taking in addition to the core three that I told you about.
Thank you, Doc, for that. I'm like, right. I know I've heard it before, but I write it down every single
Yeah,
time. So those are
right,
the supplements that we need to be taking to make sure we are safe. We are right here at the top of the hour.
right.
Marty, 30 seconds. Let us know how can we just continue to one, stay healthy mentally, and also how can we get in touch with you and hear some of the stuff that you have going on. But also, if we have someone that needs some telehealth mental services, how can we get in touch with you?
Awesome. Well, again, I love this. Continue communicating. what I love to say is speak up, speak out, and live. You gotta communicate and share if you're going through anything. Let other people know. I can be reached at Mental Health Matters with Marty on Facebook and on my podcast, Mental Health Matters with Marty, a Portia Scott Media production. And we are so grateful for that. Yes. And definitely my new website, mentalhealthmarty.com, with that as well. And we can definitely get you pointed in the right direction as it pertains to mental health. So, yes.
Thank you so much, Marty, for
Thank
that.
you.
Doc, let us know, how can we get in touch with you? I know Trisha was asking to do
Yes.
visits, as well as just how can we stay in touch with you?
Well, it's the Anwan Wellness Medical Center, and there's a direct line there. The appointment line is 678 822 9555. And that you'll get directly in touch with my administrative assistant, and she books all my appointments, the ones that I do online, because there's a set time for that. Because usually when I'm in the office, I can't do telehealth appointments because I'm rushing between room to room and stuff like that. So, yeah, call that number and you can get on my schedule. It'll probably be a little bit of a time, but it'll be soon enough.
Excellent. Thank you all so much for being here. Thank you all for listening. We appreciate you. We are here every single Sunday at 7 p.m. Eastern time. We are giving you, we are waking you up well, but right now we are giving you your weekly COVID-19 update. But stay tuned, because over the next couple weeks, we have some other topics that we will discuss. So you guys, thank you so much for joining. You know what we do every single show. We end it this way. Waking up is automatic. Showing up is intentional. Today, I will show up. Talk to you guys next week.